This is a case of blunt abdominal injury in a 14-year-old female who met with a road traffic accident hit by a truck. Here you can see large hemoperitoneum but no pneumoperitoneum. The bowels appear to be normal. The mesenteric vasculature appears to be fine. Here the upper half of the spleen is not visualized. There is no contrast extravasation, but the upper half of the spleen is infarcted. So she was taken up for emergency laparotomy in view of hemodynamic instability and significant drop in hemoglobin. There is a deep laceration dividing the spleen into two halves and there is active bleeding. There is massive hemoperitoneum in this patient. We did a splenectomy in this patient. We have a non-operative approach to our patients with blunt abdominal trauma if they are hemodynamically stable and there is no active contrast extravasation on CT scan. This particular patient had hemodynamic compromise and there was significant fall in hemoglobin. So we had to operate her. Generally, most of the patients who don't have active contrast extravasation and who are fluid responders, they can be managed by conservative approach and we can preserve the spleen. In most of the patients with blunt abdominal trauma, we can manage the patient conservatively and preserve the spleen. This is the specimen of the spleen and which shows shattered spleen. The AAST organ injury scale is used to grade the injuries in these patients, and generally grade 1 to 3 can be managed conservatively. Grade 4 and grade 5 injuries often require surgery and very few can be managed without surgery. But when there is hemodynamic instability, there is fall in hemoglobin, patient was not responding to fluids and blood, and high grade injuries, that is especially grade 4 and grade 5 injuries, are to be operated because there is a vascular pedicle injury, the branch in the main vascular pedicle injury.